So the Lake County Health Department and Community Center has 18 locations across the county, and it has just over 900 employees or so. So it's a fairly large health department, and our mission really aligns with the three core functions of public health, looking at through the assessment of needs as well as development of policy and provision of accessible quality services. We really want to promote the physical, mental, and social well-being of all people in Lake County. So when thinking about the services we provide in the health department and community health center, it's easy to break it up into a couple different categories. So we have what are known as prevention services. So really looking at the population as in general, as opposed to direct individual services. So on the prevention side, we do a lot of disease controlling and surveillance. So we have epidemiologists who are tracking disease and doing case investigations, but we also have immunizations as well as surveillance and tracking of STIs and HIV surveillance. Another part of the prevention where we're doing disease control and surveillance, which a lot of people don't necessarily know about, is we do a lot of environmental health. So we have air and water quality inspections, so we're always looking at the quality of indoor and outdoor air, because that affects people's health. And we're also having people go out and monitoring the lakes and streams and beaches to see the local water quality, as well as water well inspections, as well as septic tank inspections, because if something goes wrong with those, that could seep into the larger water and affect a larger part of the population. As well as doing food inspections, so we have food inspectors going out to all the restaurants in Lake County, making sure that codes are up to standard and food is being prepared properly, as well as to control disease. Other parts of prevention we do are alcohol, tobacco, and drug education and prevention efforts in communities. So we have teams that get to go out into different parts of the county and work really to do two things. One, to build coalitions within the community with parents and the mayor and police and other people in the municipalities, building a coalition around drug prevention. And then they're also working in the schools to kind of change the perceptions and knowledge about drug use. We have a whole area of maternal and child health. So we have nurses going out into the community doing home visiting services for mothers who have been determined to be at risk for adverse pregnancy outcomes, as well as following up with infants who may have been born premature or low birth weight. So we have nurses going out and making sure that these infants are meeting their developmental milestones, screening mothers for postpartum depression, and other services, making sure that they can both be healthy before a pregnancy, during a pregnancy, and after a pregnancy. And then another prevention service we work on in the community is the promotion of healthy eating and active living. So that's an overview of the prevention services, kind of looking at the community as a whole and trying to get as big a reach out there as possible. We also have a whole another area with our community health centers and behavioral health, where we provide more direct services to individuals. So we have 8 federally qualified health centers across the county, as well as inpatient and outpatient behavioral health centers. And at these federally qualified health centers, we provide a variety of services to local residents, including family practice, pediatrics, we have cancer screenings, as well as dental services, and also nutrition services. And then on the behavioral health side, we are really looking at both substance abuse as well as mental health. So we have drug and alcohol rehabilitation, we have counselings, and we also have therapy for individuals and groups. Community health assessments in Illinois have to be done every 5 years as dictated by the Illinois Department of Health. So regardless if you are a city health department like Chicago or Evanston, if you're a local health department like a county one like us, or if you're a state health department, in Illinois we have to do a community health assessment every 5 years, which just makes sense because health is always changing, and so there's going to be different issues that pop up every 5 years. And hospitals are doing their own community health assessments, and those are on 3-year cycles. So one big thing that's trying to be pushed is coordination of health department and hospital community health assessments, because ultimately we're assessing these same communities. So why not share resources to ultimately get the best community health assessment and therefore the best data to inform interventions in the community. So even if you're not necessarily going to be part of a community health assessment, they're still very important to be aware of, because ultimately the data that's being assessed and then the plans to improve people's health are ultimately going to be improving, hopefully, the health of your possible clients and your patient population. So it's important to see that connection. So to best assess the community's health, I really wanted to provide a broad overview of the demographics of Lake County. So there's about 703,000 people in the county. Around 80% of them have identified as white. We have about 7% each of African American and Asian Americans, and around 20% have identified as Hispanic or Latino. One of the interesting indicators I wanted to talk about was median household income, because looking at it just from the county view, it really doesn't tell the full story. So starting off at the overview, Lake County has a median household income of about $80,000. When you look at different zip codes, however, you can see that in Lake Forest, the median household income is about $153,000. Now, just 4 miles north of Lake Forest is a town called North Chicago, and that town has a median household income of only $33,000, and that's just 4 miles apart. So these are the types of distances we're working with, and just the vast levels of change with different socioeconomic indicators. Another interesting indicator that we can talk about is obesity in Lake County. So across the county, about 23% of residents 18 or older are obese. And you tack on people who are overweight, and the combined overweight obese percentage in Lake County is around 57%. So almost 60% of the entire county is either overweight or obese. The Lake County Health Department and Community Health Center conducted a community health assessment, or CHA, with the Live Well Lake County Steering Committee, which is our MAPP committee. And it's represented by both traditional and non-traditional public health partners. So traditional public health partners, we have minimal representation from the health department, because we really want it to be a community-driven initiative. But we also have some hospital systems as well as academic institutions like Rosalind and Franklin. But then we also have some non-traditional public health partners on the steering committee, kind of looking at how the broader view of health affects communities. So we actually have the Regional Housing Authority, we have faith-based institutions, we have Parks and Recreation, we have the Lake County Forest Preserves. So really, and we also have in like academics and stuff. So it's really looking at just how a broader view of health is needed to improve everybody's health. The overall idea of the Live Well Lake County Steering Committee is to guide the community health assessment process, to prioritize the community issues once all the data has been collected, as well as to collaborate with stakeholders in the community to really take action and improve the health and well-being of all Lake County residents. And the vision of the Live Well Lake County Steering Committee is to achieve the highest level of health and wellness for all in Lake County. So the first assessment we conducted was the Local Public Health System Assessment, or LPHSA. The LPHSA is a tool really to measure how well the public health system partners collectively are collaborating to provide public health services based on what are known as the 10 essential public health services. And these 10 essential services are really based on those 3 core functions of assessment, policy development, and assurance. So we had around 50 participants attend this assessment, and it was hosted at Rosalind Franklin University. We wanted a big room so that everyone could be part of this assessment. And we really, for this assessment, wanted to recruit, again, those traditional and non-traditional partners, because when you're looking at the local public health system, we really want to see how everybody is affecting it. So this assessment really kind of had two key points. One, we wanted to understand both the strengths and opportunities for improvement in the provision of these essential public health services, but really it's used for capacity building. So we're really able to recruit new partners from across the community and kind of rally them together to improve everybody's community health. Because when you're talking about public health, not everyone knows you're necessarily doing public health. An organization could be improving the community's health for years and not necessarily know that they fall under the realm of public health. So it's really about getting everyone aligned for a common and shared vision. Participants were broken into groups where they were assigned a public health essential service, and they had to discuss it and decide how well the local public health system was providing it. So an example of one of the essential services is to inform and educate and empower people about health issues. So you can imagine a variety of community organizations being able to work in that scope. So you can imagine Parks and Recreation or the Forest Preserves informing people about active living, or you can imagine local grocery stores talking about healthy food options and whatnot. So it's really about how different people in the community can all work at the same health issues. So after the assessment was over, there was opportunities for improvement identified for the entire public health system. So examples included the importance of really tracking and collecting and sharing data, not just keeping data to yourself, but using data to support other initiatives and to make everybody be more informed so that we can ultimately make data-driven decisions and use evidence-based interventions for whatever we're doing. Another thing that was brought up was just a general increased public health awareness in the community, and this assessment, that's the whole point. It's gaining awareness for the local public health system. And then another one that was brought up was assuring linkages to healthcare, because there are still gaps out there, so we need to continue to identify those. The second assessment we conducted was the Forces of Change Assessment, or FOCA, and this really provided an analysis of external forces that are really impacting the promotion and protection of the public health. And similarly to the previous assessment, we wanted the same type of representation where we're looking at the traditional and non-traditional public health partners. So we hosted it at Rosalind Franklin to have a large turnout. These forces were broken down into 5 categories: political forces, environmental forces, legal or ethics forces, socioeconomics, as well as technology and science. And these groups were formed to make sure that each group had a variety of public health partners in it. Groups are asked, what are forces that are occurring or can occur that are really going to be affecting the health of the community or local public health system? And then identifying both threats and opportunities for these occurrences. So for example, mental health, it was identified as a force that will be affecting and is currently affecting our local public health system. So threats with mental health, it could be draining resources, as well as it's hard to kind of get some data around mental health to really put numbers to the issues. And then opportunities can be incorporating mental health into primary care and just really being able to, that's where we can get creative with how we're going to work with these forces. So results were provided in a ranking of the most prominent forces coming up. So what were identified and voted on by the community were mental health, healthcare access, electronic health records, health and all policies, the changes in Lake County's population, as well as economic inequities. And these were identified as the top forces coming down the pipeline that will be affecting Lake County's local public health system. These first 2 assessments, both the LPHSA and the FOCA, were held on one day. There was planning, and then it was implemented, and the data was really collected on that one day, very prescriptive. The next 2 assessments that I'm going to be talking about were much more long-term with multiple parts for the data collection. The next assessment we did was the Community Themes and Strength Assessment, or CTSA. And this assessment really provides qualitative information on how communities kind of perceive their health, quality of life, as well as just their knowledge in general about community strengths, resources, and assets. So the first thing we did in this assessment to kind of gain the knowledge of the community was we had a community strengths survey created. And this was a interactive and collaborative process where we gained input from the community to make sure that we had appropriate information on the survey. But the survey was really to identify and understand the ideas and opinions of Lake County residents and how they view both the quality of life and health in their communities. And so we were able to distribute this survey both online and in person, and we wanted to get as many people to answer this survey as possible. It wasn't randomized. We just wanted to get a big response from the community. And with the paper copies, in-person distribution, we were really able to make some really cool partnerships with community organizations to get them engaged in this process. So we were able to partner with most of the libraries in the county. You know, libraries are a really good kind of foundation in the community that people go to who may not be likely to respond to a survey online. So we wanted to partner with strategic locations to get the largest response rate possible. And so the survey really looked at identified strengths in the community, opportunities for improvement, and kind of how the community views what their top health issues are. So looking at the results, the top strengths that were identified in Lake County in general were a really good local fire, rescue, and police services, good parks and recreation across the county, as well as they really liked their schools. And then there were the top 3 health issues that were identified were substance abuse, chronic disease, and poor diet and inactivity. And it's interesting in this assessment because we'll really be able to see how this information either supports or is different from some of the quantitative data that we'll see in the next assessment. So after we did the survey, we really wanted to learn more from the community. Surveys are great at capturing some information, but most of the time surveys will capture the what. So what we did was we planned and implemented focus groups, which really use the survey questions to start off, but then we really can get at the why and why people are answering these questions. So we designed focus groups in kind of a health equity lens, so to work and talk with groups who may be underrepresented when they are taking a survey. So we partnered with some really great organizations across the county to recruit for a couple different focus groups. So we had some really great conversations. We had a focus group in Waukegan with African American residents from Waukegan and North Chicago. We had a meeting in Mundelein with people with physical and or visual impairments, because that's a whole different way that learning about how community affects health. We had partnered with a Korean American social service organization where the focus group was actually conducted in Korean, not by me, but we had translators, and we were able to learn from different populations. And then we also had a Spanish-speaking focus group conducted with Latino immigrants. And this information really helped to support the responses from the survey. So we wanted to make sure that there was a health equity lens, knowing that the 4 focus groups we did conduct didn't represent the rest of the population, but we did our best to identify some areas for response. So by conducting these qualitative assessments in the community, we were really not only able to get firsthand the ideas and opinions from the community up, but we were also really able to create some great partnerships with important organizations across the community to really continue the conversation for improving community health. You know, the community health assessment is a process, and there's only so much you can do within a community health assessment. So there's always stuff you can do outside of it, and these partnerships are very important. And by the end of this assessment, we were able to take all the qualitative data and analyze it, and we identified some of the community's identified priorities. And they were talking about things like poor diet and inactivity, chronic disease, substance use, but then stuff that might not have been brought up in other ways, like safe and affordable housing and older adult health. So the last assessment we conducted was the Community Health Status Assessment, or CHSA, and this really provides the quantitative data on the community, kind of looking at quality of life and behavioral risk factors and just general health status. And this one took a long time, just like the CTSA as well. And so when trying to capture quantitative data, you can look at the data collection methods in kind of two ways. You can look at secondary data collection and primary data collection. So secondary data collection is really us trying to collect data from other sources who have collected data for their own purposes, but we can still use the data. So for example, the census, information from the CDC, we have access to hospital records and death records and birth records. We didn't collect it ourselves, but we're able to use this information to get Lake County estimates. And then there's primary data, and primary data is data that we, the Lake County Health Department and Community Health Center, collected. And there's a balance between primary and secondary data because there's a couple limitations, especially with some of the data that's out there. Not all data is very current. So for example, there could be some data out there that's just letting out their 2013 numbers, and if you're looking to do planning for improvement of the community's health in 2016, 2017, you're using 3-year-old numbers. So we're really trying to be creative and find ways to get really accurate data. So the health department was able to do some cool data collection methods. So especially with chronic disease, it's very hard to get real-time estimates. So one thing we did was we were able to do a randomized community survey that got sent out to about 5,000 residences across the county, and they were able to either go online and fill out the survey or phone in and listen to one of my coworkers' voices on the survey. And this survey really got at individual just health status, chronic disease, behavioral risk factors like smoking and alcohol use, looking at kind of behavioral health stuff like, has your mental health kept you from doing usual activities over the past so much time, stuff like that. And it was really able to give us real-time data that you can't find other places. So we have 2015 estimates for chronic diseases, where the best estimates for other years might be a couple years ago. And another cool thing that we were able to do is one of the people at the health department was able to kind of find a way around getting obesity data. So just like any other chronic disease, it's not very readily available, but we figured, where is a way that you could get height and weight data? Well, we all have driver's licenses, and we all have to report our weight and height. So what we did was we were able to get information from the Secretary of State to provide de-identified driver's license information where we could get zip code, height, and weight. And okay, I know everyone on their driver's license is going to overestimate their height and underestimate their weight, but if everybody lies together at the same rate, you can adjust for that scientifically. So that's what they did, and we have a real-time estimate of weight status. So those are just cool ways that when you're doing community health assessment, you don't need to do this with your blinders on. This is where you can get creative, one, if the data's not there or if there's better ways to collect the data. So the CHSA really tried to grab a bunch of different types of health data and put it into one report. So it's pretty lofty. We have information about demographics of the county, so that's just looking at race and ethnicity, socioeconomic status, so like looking at poverty levels, and just like health insurance coverage across the county. Then we were also looking at stuff like quality of life. So does your physical health or does your mental health kind of keep you from doing usual activities? Has it kept you from work? Stuff like that. We've looked at behavioral risk factors, so smoking and alcohol use and other risk factors. And then we've looked at stuff like mental health. We also were able to gather a whole bunch of information on maternal and child health. We have access to birth records, so we're able to gather birth rates and calculate, preterm birth, low birth weight, prenatal care types of deals. And then another whole bulk of the assessment was kind of getting at death, illness, and injury. So from that survey I was talking about, able to get a lot of real-time chronic disease, both for the county and at lower levels, looking at zip codes, looking at what the top identified causes for death are, as well as like infectious disease. And then after we have all that health information, we also want to, very important, look at contributing factors to health and wellness. So stuff that isn't physical health but will affect your health. So looking at nutrition, so finding out if people are eating their recommended daily vegetables and fruits, are they drinking water instead of sweetened sodas and beverages, how much physical activity people are getting, what people's level of educational attainment is, as well as income levels, because all of those trickle into affecting people's health. So after the 4 assessments were completed, we needed to find some way to take all that data and put it together and objectively identify what the key priorities moving forward in the community were. So what we used was a tool called the Hamlin Method, and we actually kind of modified this tool, but it's been used at other health departments for objective rankings of their health priorities for their community health assessment processes. And the Hamlin Method really looks at both the size and the severity of a health problem. So size is pretty straightforward, how many people are affected by obesity, so also known as prevalence. But then it gets a lot more intricate when we're looking at the seriousness of a health issue. We first look at morbidity. So does this health issue affect your productivity? Do you lose work days because of this type of health issue? What are the medical costs associated yearly with the health issue? What are the unrelated costs that are also associated? And just overall quality of life. And then we look at mortality. So does this health issue lead to early death? Is it identified as one of the top causes of death in Lake County, or is it even a top 5 cause, because we want to be able to rank them? Then we make sure to include health equity in everything we do. So we have health equity measures. So is a health issue inequitably present in a certain population? Are they more likely to get a health issue? Are people dying earlier from this health issue in certain groups? Or are people just dying more in general because of this issue? And then ultimately we want to be able to look at comparability. So does this health issue in Lake County, how does it compare to the other counties that we border? How does it compare to Chicago? How does it compare to Illinois? And this is a very data-driven process, and it's really used to help minimize bias during the prioritization process. So the assessment team took all the data from the Hamlin Method and made it really easy to understand in the form of infographics. So these infographics included all the key variables that we used in the prioritization process. And these infographics were given to the steering committee because we didn't want to just give the steering committee like an Excel file to make informed decisions on. We wanted to make it easy to understand and engaging and make it a part of their process. So the steering committee was given these priorities to mull over, and ultimately the steering committee had to make 4 votes on what the top priorities were. Each organization in the steering committee was given 4 votes, and they were tasked with voting not on their personal preference, but on behalf of their agency. So they went through the voting process, and the top priorities that came out were obesity, diabetes, cardiovascular disease and hypertension, as well as behavioral health, which includes substance abuse and mental health. And I mean, these priorities are the usual suspects. They came to light because of this process, but looking at the data, they're very prevalent in the county. So either someone has one of these conditions, unfortunately, or they know people who have them. So these are priorities that everyone can get behind so that we can all make an effort to improve them. After the 4 priorities were voted on by the steering committee, we had to make measurable goals and objectives for each of the priorities, because to see if we're making any impact, we have to be able to measure it. And before we created the goals and strategies, first we had to really identify linkages between the priorities as well as community factors that are affecting them, and then also identifying the areas that have the highest need. I discussed earlier how socioeconomic status can really affect health status, and a really good example of that is how educational attainment affects chronic disease in the population. So from our community health status survey, we were able to compare different levels of educational attainment with prevalence of the chronic diseases like obesity, diabetes, and hypertension. So from the survey, we were able to identify that as a person, or in general as a population, has a higher level of educational attainment, the prevalence of those chronic conditions decreases. So there's almost an inverse relationship between educational attainment and chronic disease. So another useful tool we use to identify the highest areas of need are MAPPs. MAPPs are a great tool, and we're able to really visualize patterns of socioeconomic status and how it aligns with health outcomes. So one example is median household income and obesity. And as you can see in the map, areas of Lake County that have a lower median household income have higher rates of obesity. So ultimately, we want to have these outcome objectives, which are really measurable long-term consequences of the interventions we're going to be doing in the community to affect these 4 priorities. So we're really trying to decrease prevalence of these chronic diseases, as well as reducing hospitalizations related to these conditions. The next step is figuring out, well, how do you go about doing that? Because, if I had told you, go reduce the prevalence of a condition or go reduce hospitalizations, we need to have strategies. So what we've had to create are strategic issues, which are pretty much things that we've identified as critical changes that need to be addressed in order to improve the health of the county. So we've identified a couple, and one of them is looking at the policies, systems, and environment. So looking at how we have constructed our local systems and looking at how what has been done is affecting people's health, or what can be changed to affect people's health. Another one is really increasing the physical activity in youth and adults. Another one is improving and promoting nutritional opportunities in our local food environment. We also want to improve clinical interventions for chronic disease, as well as improve behavioral health capacity and infrastructure. So these strategic issues, if we all work at these, will ultimately trickle to affect the 4 priorities. And the cool thing with these strategic issues is they're specific enough where we can work with specific community partners who already work in these sectors, so we don't have to be looking around for people to affect this change, because people are already doing this. We just need to align them with the community health improvement efforts. The final part of what we've been working on is ultimately the continuous part, and it's the action cycle. And so what we've done is we're creating action teams that are being formed to select and implement evidence-based interventions to really move the needle on these health priorities. And these action teams are comprised mainly of community partners, but there is some support from the health department. And these action teams align with those strategic issues. So one of the action teams is about being active and getting out there and walking. Another one is about eating well and making sure the local food environment is able to support the community. We also are going to be doing diabetes prevention and management, tobacco prevention and cessation. We have a whole action team about behavioral health capacity, so really looking at behavioral health in schools, telepsychiatry, communication campaigns, and just integrating behavioral health into primary care. And then a whole other action team on health literacy. And by no means should these be the only initiatives being done in the community. These can be seen as models to align with other organizations and sharing resources, but to improve everybody's health, we all need to be working together to affect these 4 priorities.